Another day, another story. The first robot-assisted dual kidney transplant in the United States has been successfully completed. This innovative surgical procedure was performed using advanced robotic technology to transplant 2 kidneys simultaneously into a patient. The use of robotic assistance in kidney transplants offers several advantages, including greater precision, smaller incisions, and potentially quicker recovery times. Welcome to Turbo Eminent Channel. This breakthrough could pave the way for more widespread use of robotic technology in complex transplant surgeries, improving outcomes and expanding the possibilities for patients in need of organ transplants. 4 months out from the actual surgery, the United States' first robot-assisted dual kidney transplant has been deemed a resounding success. The patient's health and comfort after the procedure lend robot-assisted transplant surgery an extra dose of credibility among those sitting on organ waiting lists. Joanne Kukala, a 70-year-old Ohio native, underwent the procedure at Cleveland Clinic in March 2024. In 2021, Kukala was diagnosed with multiple myeloma, a form of blood cancer that takes shape in bone marrow. Chemotherapy and a bone marrow transplant eventually put the disease in remission. But Kukala began to experience myeloma kidney, a form of kidney failure seen in at least 20% of multiple myeloma patients. Kukala was placed on the United Network for Organ Sharing (UNOS) transplant list, after which she awaited a viable donor kidney. Donor kidneys are in fairly high demand, forcing patients in need of a transplant to sit on the wait list for 3 to 5 years. Depending on the severity of a patient's kidney failure, they might experience extreme health complications or die while awaiting a viable organ. To provide transplants to as many patients as possible, doctors occasionally utilize 2 marginally effective kidneys from a deceased donor to perform or exceed the duties of a single healthy kidney. The downside of such an approach is the potentially invasive nature of a dual kidney transplant. Rather than making a small incision on one side of the abdomen, conventional surgery requires incisions on both sides. A surgical robot wrapped in protective plastic in the operating room. A surgical robot used at Cleveland Clinic. Credit: Cleveland Clinic. With its slender instruments and imaging capabilities, robot-assisted surgery circumvents this issue. Instead of using 2 incisions or a big midline incision, we can place the kidneys on both sides of the torso through one small incision, said Dr. Mohammed Eltamami, who conducted Kukala's procedure. The robot, described only as an advanced multi-port robot by Cleveland Clinic, offers high-definition, magnified 3D imaging in real time while exceeding the flexibility and range of motion of a human wrist. Together, these qualities make the robot an excellent surgical assistant while reducing the patient's likelihood of experiencing incision-related complications after surgery. Kukala was able to go home 3 days after the dual transplant and experienced minimal pain. Robot-assisted surgery isn't new to Cleveland Clinic, which conducts about 30 robot-assisted single kidney transplants each year. But Kukala's procedure was the first of its kind to take place within the United States. In 2014, surgeons in Italy performed the first ever robot-assisted dual kidney transplant on a 63-year-old man with end-stage renal disease. 24 months later, the patient was well and did not require hemodialysis. Surgeons in India performed the same procedure on a 53-year-old patient in 2018 with similar success. As robot-assisted dual kidney transplants become more common, they could make a dent in the number of people awaiting donor kidneys at any given time. In the US alone, that number tends to sit around 90,000. In a groundbreaking medical achievement, surgeons in the United States have successfully performed the country's first robot-assisted dual kidney transplant. This innovative procedure marks a significant advancement in the field of transplant surgery, leveraging cutting-edge robotic technology to enhance precision, reduce recovery times, and improve overall patient outcomes. The procedure. The historic surgery was conducted at name of the medical center, where a team of highly skilled surgeons used the latest robotic systems to transplant 2 kidneys simultaneously into a single recipient. The procedure involved several intricate steps. Preoperative planning, detailed imaging and planning were conducted to map out the exact placement and connection points for the new kidneys. This step is crucial for ensuring a successful transplant, particularly when dealing with dual organ implantation. Robotic assistance, utilizing robotic arms, the surgeons were able to make smaller, more precise incisions than traditional methods allow. The robots provided enhanced dexterity and control, enabling the team to perform the delicate tasks required to attach the kidneys to the patient's blood vessels and urinary tract with exceptional accuracy. Minimized invasiveness. The minimally invasive nature of the robotic procedure significantly reduces the physical trauma to the patient, leading to smaller scars, reduced pain, and a quicker recovery compared to conventional open surgery. Benefits and implications. The success of this dual kidney transplant highlights several key benefits and potential implications for the future of transplant surgery. Enhanced precision. Robotic systems offer unparalleled precision, reducing the risk of complications during and after surgery. Quicker recovery. Patients undergoing robotic-assisted surgery typically experience faster recovery times, allowing them to return to normal activities sooner. Broader applicability. This success opens the door for robotic technology to be applied to other complex transplant surgeries, potentially improving outcomes for a wide range of patients. Patient impact. The recipient of the dual kidney transplant is reportedly recovering well and showing positive signs of graft function. The success of this procedure offers hope to many patients on transplant waiting lists, particularly those who may benefit from dual organ transplants due to severe kidney disease or other complicating factors. Future prospects. The success of this first robot-assisted dual kidney transplant sets a precedent for future surgeries and may inspire further research and development in the field of robotic-assisted organ transplantation. Medical centers across the country and around the world may look to adopt similar techniques, ultimately improving the accessibility and success rates of transplant surgeries for patients in need. Benefits of robotic-assisted transplants. The success of this robot-assisted dual kidney transplant underscores several key advantages of using robotic technology in surgical procedures. Precision. The enhanced dexterity and stability of robotic arms enable surgeons to perform intricate tasks with greater accuracy. Reduced recovery time. Smaller incisions and less tissue trauma lead to faster recovery and shorter hospital stays for patients. Lower risk of complications. The precision and control offered by robotic systems help minimize the risk of surgical errors and postoperative complications. Conclusion. This historic achievement represents a significant step forward in the integration of robotic technology with surgical practice. As technology continues to advance, the potential for improved patient outcomes through precision, minimally invasive procedures is immense, promising a brighter future for organ transplant recipients. The first robot-assisted dual kidney transplant in the United States marks a significant milestone in medical history. Thanks for watching. Request you to subscribe the channel.